she has any pain in one specific spot more than the other, I'm going to have her sit right where the pain is. And I'm going to have her hold that until the pain relieves. She's going to foam roll for a minute, and she will do this 3 times each side. For my last technique I'm going to show, I'm going to do Graston. So when you sign for me. For Graston, I'm going to palpate down the IT band to find any knots that she may have. For my blunt object, it'll magnify any restrictions that are within the band. So I'm going to apply the instrument and put pressure to break any scar tissue that's going to be in there to relieve any discomfort and to restore any normal function. For the instrument, the more narrow the edge is, the more it's going to separate the fibers, depending on the goals I'm going to use. Depends on the instrument I'm going to pick. This technique is going to be used in conjunction with a stretching program and a strengthening program. And if there's any discomfort after this technique is used, you can apply ice to relieve any of the pain that is caused. For the second portion of this video, I'm going to do a posture assessment for Katie. For the plumb line, it's going to go right down the midline of the body, so it's going to go right down the middle. Some of the landmarks you're going to look for are the earlobes. For Katie, her earlobes are normal and level. For the shoulders, you're going to look at the acromion processes. Her acromions are level. You're going to make sure it bisects the belly button. For the lower body, you're going to look at the iliac crest. And her iliac crests are level. You're going to look for her ASIS. And both of hers are level. For her knee position, she has some genufalgum, so her knees go in towards the midline. For her patella position, both her patellas are level. Both her medial malleoli are level on each foot. But for her foot posture, she does have a pronated or flat foot. For the lateral view, we'll just turn to the side. The plumb line should go right down, go right through the shoulders, and then bisect the hip. As you can see, if we had a plumb line, Katie has a slight forward head and forward shoulders, and her lateral malleolus are posterior to the plumb line, as they should be. And lastly, for posterior, so just turn with your back facing the camera. Her dominant shoulder should slightly be lower, as you can tell. Her right is slightly lower than her left, which means her right scapula will be slightly lower than her left. In looking, she has some scapular winging. As you can see again, she has a genufalgum knee position and a pronated flat.